Hey everybody, welcome to the Men of Doozy podcast.
Yeah, hi everyone.
Oh, my neck, my back,
My shoulder.
my crack.
You're cracked too?
Yeah, I have a neck, I have a pad.
Are you sitting on a cushion
Yeah.
too?
What happened to you?
You know, it's the craziest thing. I scatted too hard last week.
Oh!
Yes, welcome to the Men of Doozy podcast. You know, you guys are probably thinking, what the hell is going on? What does that mean?
Oh, and my hand hurts. Well, the word doozy means something that is extraordinary or outstanding of its kind.
And if you can't tell, we are not that.
Hey, but we're in great shape.
Yeah, we are. We are perfectly healthy.
Yeah, and we want to be even better than this.
Yes, and so this is the podcast that we are going to give you the tools that you need to become successful in life. How do I do this? How do I do that? How do I not break this or injure this? How do I nurse myself back to health? I need it.
Yeah, you do. And the best part is we're going to learn how to be successful ourselves while you learn to be successful yourself. And this is a prime example of what not to do, you know?
Yeah.
We'll find out more here.
It makes sense to me.
I'm Alex Snap My Back Staub.
And I'm Kirk Snap Crackle Pop Koz.
Kirk, what are we talking about today?
I think you should probably have whiplash. You know, I think it's pretty evident. We all have bodies. We all have to stay healthy and keep care of our bodies.
That's presumptuous.
I don't identify as having a body.
Yes.
No, I'm just a vessel. No. So
I feel like just a head right now.
yeah, right, just a floating head. Guys, it's one of the most important things, taking care of your body. Especially if you injure it. You have to know the proper ways to nurse yourself back to health or get the proper help. We are going to learn how to physical therapy.
Yeah. And
But this is a
let
special
me ask,
episode.
have you ever been to physical therapy?
You know, I actually have. It was at some point, I remember at some point in high school, there was something with a lower back injury that I had. And I don't know whether it was something with a disc. It wasn't like any type of I don't even know the terminology, like a dislocation or like a whatever disc thing. But it was like I went to like 2 or 3 physical therapy things, and I was given exercises just to kind of like help the mobility of just moving in a way that was a little bit more restricted because of it. And it actually, that's been, I think,
and
working.
you never twerked again.
I never twerked again. But that's actually one thing that I think for me, and I think is a common thing, is lower back things.
Yeah.
Maybe I'm just being presumptuous, but I mean with so many people working desk
No,
jobs.
I had
and
a lower
stuff,
back injury as well. Yeah,
and that's why. I think
from a trampoline.
tell me more. Is
So
that what happened here?
Yeah. This is what happened.
Did you jump on the trampoline?
I had a trampoline, and I was doing flips on it, and I don't know what happened, but I flipped and I landed on my neck or my side, or I just landed the wrong way. And my lower back, it was I had bulging discs or something in my lower back, and I remember getting off the trampoline and my entire body was just pins and needles, and I couldn't really feel my body, and I was like, what the fuck? And I remember to feel my body again, they had to pull me, take my arms and legs and literally pull me apart so that
like William Wallace.
Yeah, I don't
and
know.
Mel Gibson in the Braveheart.
Yeah, they had to pull my spine apart just so I could feel again or some shit. And yeah, I got X-rays, and it was it was L2 or R2 or something like that.
R2D2.
Yeah, it was R2D2 in the numbers there. I just remember that.
disc was off the rails.
Yeah.
But
So we got rid of the trampoline.
You know, what this shows is how important taking care of your body is. And I would say, for me, I think my first foray into understanding how important, like, stretching and certain things like that was when I started to, like, really work out. And it's like, you can't be working out or knowing where you need to strengthen. Like, over the past few years, I've realized I need to be really, really smart about how I move when it has to do with like if plyometrics or something with like a lot of pressure that puts a lot of on my lower back. And over time, I've strengthened that part of my body. But I think physical activity and probably like post surgery. I'm just making assumptions here, but it's so important, physical therapy, because if you do the wrong thing, I feel like it could. I mean, look at us. I've been wearing this. I've been wearing this for the past 3 months.
Yeah,
I've just been playing it
for
off.
pleasure.
Cool.
Yeah.
Pleasure.
We clearly don't know what the hell's going on here, so we needed to call in some professional help.
That's
here.
Right. Now this is a very special episode.
Very special episode.
Very professional help we have.
No, we haven't had a guest in a while. And so this is going to be real fun. We
need somebody to keep us on track.
We have someone here all the way from Tampa. He's a world-renowned physical therapist, and his methods are in over 40 countries, okay? He's worldwide. That's worldwide there, right? He has a clinic where everyone who has failed, from other therapists, they all go to him, and he's got a 99% success rate in fixing them.
Oh, my God.
He understands the body, okay?
Yeah.
And we have the pleasure of learning from him. Everyone, put your crutches and your wheelchairs together for Ryan Whelton.
Hey!
What's up, everybody?
Ryan, welcome. Why don't you tell us a little bit more about what you do and where, maybe even like when you started doing physical therapy and when it kind of became your passion and what like brought you to the point that you're here today with us.
Yeah. It's hard to take you guys seriously with neck braces, but I'll do my best here. Because I know neither of you are injured.
That's preposterous.
What?
All right, so
I feel injured.
My ego is hurt every time I record this stuff. Anyway.
See, 99% success rate. I can move. Every other doctor told me my neck was broken.
But you said words, and I'm. So yeah.
Yeah.
So tell us a little bit about yourself.
In high school, I played football, and I used to get hurt all the time. I had to go to physical therapy a couple of times, and I'm like, this is really interesting, and I would try to figure out, like, they said you pull your hamstring, and I'm like, well, what's that? Like where does that attach? So I would look it up and stuff like that. I was always intrigued by the human body. And then I ended up going to Northeastern University in Boston, and they had a physical therapy program. So I'm like, I'm in, let's do it, So I started off there, and I went through, all the way through Northeastern, ended up, 6-7 years later with a doctorate degree in physical therapy. And then It was too cold up north for me. So I moved to Florida, and I always say I was born in the right family, wrong place. So I ended up moving to Florida. And I worked, at a few places, and then I opened my own practice, which is where I am in the Tampa area. Interestingly, when I first started off, insurance companies, they said like they go off of like a saturation point, like how many physical therapists are in a demographic area. So they wouldn't let me into their insurance networks. So consequently, I was charging, I was doing it outside of insurance, but I was also seeing people that were willing to go outside of their insurance, which are usually the people that are desperate, that have failed everything. So anyways, and so I started seeing these people in here all the time, and over half of them have thought about killing themselves. Like, I'm like, where am I? I'm like, I didn't even know these people existed, and I had been a therapist for years at the time. And I started to delve into this chronic, severe pain world that had failed literally everything. You name it, I call it the story: physical therapy, chiropractic, injection, surgery, orthopedic surgeon, neurosurgeon, x-ray, MRI, massage, acupuncture. They had all failed everything. And, they're crying and it's just like, what is going on here? So anyway, so I just like, it's just me in here. I'm a lone wolf. And I just started to try to figure out what was wrong with these people. And I invented ways of helping them. So I'm like this serial inventor, treatment method inventor. I made a lot of orthopedic discoveries. I've published a lot in medical journals, and I'm trying to get it out to the world how to help these people that have no hope, and a lot of them end up in psychiatric clinics, which is what it looks like you guys might need there with the psychosomatic pain. They get put in psychiatric clinics for having fake pain in their brain, but they're not faking it. They are legitimately in pain, but it's an invisible injury that doesn't show up on x-rays and MRIs.
Wow. It's you were talking about what these people are going through. I mean, it is an emotional you see those videos online. I think it's awesome that you provide this relief because you, as I was saying, you see those videos of people who have just this chronic pain like you were describing, and it is a beautiful thing that there are people like you out there that can provide this relief. Now, you mentioned when you were speaking that you've invented certain ways. Before we jump into to provide certain relief, before we jump into these tips, is there one or two that you could describe to us, like an invention that through your physical therapy that has been life-changing for some of your
so there's the most common issue obviously is back pain. And years ago I started seeing these people come in here and they all had the same story, that they had the same symptoms. They all complained of they've been told for years they had sciatica, but they they had herniated discs on an x-ray and MRI. On an MRI they had a herniated disc, but I'm sitting there and it's just like they one after another, the same story. So there's also another thing that can happen, which is that can cause pain, numbness, and weakness down the leg, which is something called sacroiliac joint dysfunction, which can refer down the leg, right? So when I came along, there was no real way to diagnose sacroiliac joint dysfunction. There was a way, but it was kind of wishy-washy, and there wasn't any way to confirm it. And nobody really knew what caused it. It was, kind of could be this. It was real wishy-washy. So I just started working with I had no idea. I just started working with people, and I just started to notice that they all had the same misalignment, like all of them. And anyways, so I went back to my books and I'm like, well, what muscles can I strengthen to fix this misalignment, right? So I actually have a bone model here, so we'll get real high tech here.
Awesome.
And they all had,
look at that.
This is your sacroiliac joint right here. They all had what's called an upslip and an out flare, and that was it. And when I pulled on their leg and brought it back down and realigned it, and by opening this up, all their pain went away down their leg too. So I created an evaluation method that I actually published it. You can find it on my website, wheltonmrt.com. I published it in a medical journal. I created an evaluation method in a protocol that works for me 99.9% of the time. And I have people all over the world that are getting those results too. And they're able to immediately deduce whether it's sciatica or whether it's that SI joint dysfunction referred pain chart that the medical system really doesn't look too closely at, because there was no way to look and definitively say, oh, it was SI joint or it was, sciatica, so they get misdiagnosed. And a lot of them, most of my patients have had surgeries, they've had their spines fused and it didn't work. And the reason why, and they come in here and in 30 seconds they're out of pain when I just do what I showed you with the bone model. Wow. And it was like that what was causing their pain. They had a herniated disc, they had surgery on it, but it didn't relieve their pain because their pain was actually mechanical.
Wow. I think this is a great place to jump in because it's
also the models looked like you a little bit in the one model there. Yeah.
Yeah.
But I'll say when I think of physical therapy, I think of people who understand, I think of you we're all different body parts are connected in certain ways that you would never think of. If you press your thumb too hard, you shit your pants or something, or Or like if you,
I've actually seen
right,
that.
or like if you like tickle your foot, like you sneeze or something like that.
Yeah,
Like,
yeah, yeah.
like is there like parts of the body where like one thing is like connected to something else that you would never even think about and stuff like that, or?
Yeah, so I actually, a lot of people in my field know me from my orthopedic discoveries, but I actually mapped a system that, and I have 1,000 pages of maps of the body, these intricate maps that serve as off switches for pain. So any of my colleagues that take that course, they can get 8 to 9 out of 10 people that walk into their clinic, full range of motion and no pain immediately, because I found off switches. But the points are on distant parts of the body and they're fluid. So like, let's say like right here, connects to right here. If you have pain here, it'll shut it off. But if you turn your hand over like that, it doesn't connect anymore. There, it connects over here. If you turn your hand over like that, it doesn't connect anymore. It connects here. If you go like that, it connects down here. And if you go like that, then it connects way up here. And the same thing, if you move your hand around like that, now it connects way up here versus down here. So anyways, you don't have to know that.
Wow.
I mapped it for my colleagues at certain joint angles and angles of pressure so that they can just reproduce it. And it's used in 40 countries now and everybody's getting immediate results. So
Ryan, you're literally an encyclopedia of the body, which is it's insane. I think this is a great way, a great place for us to just jump into these tips. What do you think?
Yeah, let's do it.
It will be. I have no doubt these tips are kind of exploring the entire body. You know,
yeah,
the neck, the back,
yeah.
You know,
I love how your thumb is in like the.
This is what keeps it.
Yeah.
So,
yeah.
Do you want to jump in?
Yeah, these are the top 5 tips on how to physical therapy from Ryan. He's gonna teach us,
and we're gonna teach you.
Yeah, and we're gonna teach you. Okay.
From him.
Yeah.
Let's go.
Number 5, everyone. Yoga prevents injuries.
This is a commonly known thing, right?
You ever done yoga before?
You know what? I have. It's yoga, I believe, well, off the top of my head, I feel like it's probably the most commonly used form of exercise, probably globally. Is that correct, Ryan?
Yeah, it's become obviously mainstream nowadays. 30 years ago, it was considered woo-woo, like most things. It just takes 30 years to kind of hit mainstream. But no, yoga, I'm very curious. So I'm always asking myself, like, who are these people in here and why are they here? Why them? Why not this person? Why not that person? And then when I realized a common denominator of people that I don't treat, that don't ever have to come to me, just very rarely, are people who do yoga. Flexibility prevents injuries. People who are tight and stressed and obviously weight can cause compression of the joints. Those are the people that I typically see in here, but I almost never see yoga people in here, so flexibility prevents injury.
That's so interesting.
I used to do a lot of before the pandemic when I was working out all the time. I'd throw yoga in there at least once every two weeks or something like that. But it was Bikram yoga. It was the hot yoga. Just because my dad used to do it. Our whole family does they're all the yoga and they all love that stuff. So I used to do the hot yoga and I would come out of there you lose 12 pounds in sweat and you're feeling loose and you feel relaxed and it's great.
Yeah. Ryan, I'm not unsure if you were aware of this, but pre-pandemic for 2 years, I worked at a fitness studio. And so it was it was the first time in my life that I was active, consistently. And one thing that I found, to loop it into this tip was yoga was preached. We had some yoga classes here, but at one point it kind of fizzled out because New York, they want their hard, high intensity workouts. But one thing that was always preached was how important that warm up and that cool down stretching was, because there's nothing better than a really good stretch. That makes sense.
Now he just eats a lot of yogurt.
Oh, that was bad. That was bad, dude. I thought I did. Oh no, yoga to yogurt.
I even looked out.
Oh my god, that was. I'm mad at how bad good that was.
Zing.
Yeah,
Do you do yoga? Ryan?
I do. Yeah. No, I stretch every morning usually, and I meditate, and I try to,
What's like the best stretch to do? Like if you don't do yoga classes or whatever, what's like the best like stretches to do in the morning when you wake up?
Yeah, yoga-centric things that are easy accessibility for.
Because I'll do downward dog all day, you know?
Yeah, what I actually recommend is, especially for back pain, is the piriformis stretch, which is you just take your knee and bring it to the opposite shoulder, like in that direction, like that, that one, and just letting your legs fall to the side is a great, two great stretches to loosen up the back.
Knees.
I've always found I mean downward dog obviously, but also I think with a history of some little flare-ups with the lower back, child's pose has been like a lifesaver sometimes with yeah.
Mm-hmm. Yeah.
Shall we move?
Kirk cries a lot when he does yoga too, which is
That's why I don't do it very often.
That's why we stopped doing yoga together.
Together? And then I started eating yogurt.
Yeah.
While we did it.
Yeah. And now look at him. Okay.
Now this is
hey, do yoga. Get
yoga.
flexible.
Because also this is a great tip because it's just like what you were saying, Ryan. It has become so mainstream, and it is a easy. It doesn't discriminate against a body type or anything. It is something that everybody can do, and you can work into it, and it gets more complicated as much as you want it.
When you're doing yoga though, and you're out of shape, I can feel it for sure.
Yeah, for sure. Yeah.
I'm sweating. I feel gross. I can't touch my toes. I'm like, wow. And there are people in like the yoga classes that are just bending like pretzels. They're on like their toe doing like some eagle pose, and I'm like, that's not me. I'm out of shape.
You should try for those reaches down to your toes. You should try putting some yogurt on the floor.
Yeah. Okay. Yeah.
Run it into the ground.
Yeah.
Let's go. Anyways, yeah. Guys, do
Instead
yoga.
of go yoga, it's yogurt. Yogurt.
Anyways, guys,
All right.
let's move on to the top 4 tip. The top 4 tip is inflammation causes pain and disease, or inflammation cause pain and disease. Change your diet to vegetarian, usually reduces pain. Got it.
So I was actually a vegetarian for 5 years. Yeah.
Wow. I
went to go see my Uncle Bill in Hawaii, and I was out there with him for a month, and Xavier, and when I became like a vegetarian out there with him, and then when I came back, I decided to keep going because I felt great, and I did it for like 5 years, but I don't know, and then I went back to eating like the meat and stuff.
Yeah. So Ryan, have you found with some of your patients or clients that, especially with new clients, that their diet, like if they are eating a lot of meat or they're eating having a lot of yogurt or dairy, that it can, some of those foods are direct correlations to inflammation in the body. Is that correct?
So the reason why, when you take, what do you do when you have pain? You take an anti-inflammatory, right? And that relieves the pain. So it's inflammation that's causing the pain, right? Well, inflammation also, a lot of medical doctors will tell you, is the cause of most disease too. So that happens with stress, environmental factors, diet, So when I take people with severe arthritis, especially in the spine, I actually have them first they have to talk to their doctor so if they're on medications, because sometimes it can work too well, like for blood pressure, and just bottom them out. But I actually have them do a 3-day juice fast, like you had done with Xavier there.
Yeah.
3-day juice fast. And then I say, I want you for the next 4 weeks to eat plant-based. I want you to eat foods that come from planet Earth, not modified, not genetically modified, organic, no pesticides on it. And I want you to do that for 4 weeks. And usually after the juice fast, they're like, oh yeah, can I golf now? because it just wipes the inflammation out of their body, changes their biochemistry versus taking something to reduce inflammation. You know what I'm saying? Then you just got to keep it up,
Wow. Yeah. Yeah, it is really crazy. It's all so connected. That's something that has been interesting to me, these type of like fasts or these juicing type of things.
Yeah, eat healthier and you'll feel better. Like if you go to Taco Bell and crush burritos,
I mean,
you're not going to feel good. That's inflammation, right?
Yeah, I ate yogurt and Taco Bell yesterday. This is what happened. No, I'm kidding. This is what'll happen, guys.
Yeah.
No, yeah.
You're moving your arm pretty nicely over there. Are you faking it?
Oh my God, I'm healed. It must run in the family.
Yeah.
No, yeah. I think this is such an important tip. I mean, what you put in your body.
Eat healthy. So any kind of juice things you recommend, like juice drinks?
I just say apples, carrots, kale, whatever you can tolerate. I do fruit smoothies in the morning. I just kick coffee, so I just do fruit smoothies like strawberries, blueberries, bananas, stuff like that. Do it for 3 days. On the second day, I think you've done it before, Alex, where you feel like crap. It's called the detox flu.
Yeah.
Like your head's foggy, you feel awful. Just push through it. And usually on the end of the third day, fourth day, you'll feel a level of energy you've never felt before. You feel like a hero.
Yeah, I did the master cleanse for 10 days. I drank nothing but lemon juice and like a spoon of maple syrup and like cayenne pepper and water. And for 10 days I did that. And yeah, the first couple of days I felt horrible, but on the other side of it, I felt like amazing. I was like hiking every day, going scuba diving. I wasn't eating anything for like days and I felt amazing. It was a good like reset, lost a bunch of weight. And then does drinking alcohol cause inflammation?
Well, it's definitely not good in chronically drinking. So, no, it can, sugar is not good. It's got a lot of sugar in it, and sugar is not good for the human body. Processed sugar, is not good for the human body. So, inflammation is the cause of most disease and pain. So if you, I always tell people, change your diet. If you're on medications, you got to talk to your doctor first, but it'll probably get you off medications. My father died at 59, and all my uncles on that side of the family are dead, or, earlier, than they should have died, if you ask me. And they all had heart issues. And I had triglycerides that were like 300, which is like twice the normal limit, and cholesterol at 25. And they wanted to put me on all kinds of, medications like my dad. And I'm like, I told the guy, I'm not doing that.
Yeah.
I saw that happen. That didn't work. And so I watched that documentary on Netflix, Forks Over Knives, which is about plant-based diet. Yeah. And in 3 months, all my blood levels were normal. And I thought they made a mistake on the thing. I was like about to call my doctor, and then it hit me. I'm like, oh, it was my diet, So
yeah.
I just went plant-based,
Yeah.
I feel so much better. I have much more energy,
Yeah, when I was a vegetarian, I definitely felt like lighter on the inside. And like just because my body was just processing just like leaves and berries and sticks
and cayenne
pepper. And so there was like nothing really like, it wasn't processing Taco Bell and all that stupid stuff, So yeah, keep the tank running on some good stuff on the inside.
All of this talk about diet is making me hungry.
Oh, baby. Let's go to a quick ad break. Hey, Kirk.
Hi.
You know what sucks?
What?
When I'm trying to do yoga and I look over and you're just eating a gallon of yogurt.
Oh.
That sucks.
Stop. You know what doesn't
For
suck?
you, what?
Botticelli Foods.
Oh, wow. That makes sense.
I'm tired of my physical therapist, Ryan Whelton, telling me I should stop drinking to fix my injuries. I'm also tired of buying expensive, low-quality foods.
Yes.
I deserve the nice things. I deserve the quality things to help nurse me to health.
Yes. And Botticelli's is family-owned and operated with 4 generations in the food industry. They bring an experience to your table that transports you to the heart of Italia.
I think Ryan probably has done some physical therapy there for people, right?
Have you, Ryan?
Where?
Italy?
Italy.
I have people doing my methods in Italy. But
Nice.
I don't go there and do physical therapy.
All right.
So if you go to BotticelliFoods.com and use promo code Doozy, that's DOOZY at checkout, you can get 15% off all Botticelli Foods products.
Oh, yeah. We're talking pasta. We're talking sauce.
You ever do a sauce cleanse?
Yes. You know, when I was in Hawaii, for 10 days, I only had Botticelli olive oil.
That is.
And let me tell you, the inflammation.
Yeah.
Yeah, no, it was, and then I did another 10 days just strictly the Alfredo sauce, and it was delicious. The heartburn, though, was really bad, but not as bad as
25 pounds.
not as bad as Kirk's drinking problem. Also, they got balsamics and many more flavorful products. They even have like those like sculptures that Ryan has in his office of like sauce trees, right? That's where sauce comes from.
Yeah. Guys,
Right.
Botticelli Foods are extraordinary and outstanding. Just like the R2-D2 disc in the back of Doozy.
And now back to the
to the
therapy.
physical.
So hey, how do you feel? Hey,
I
we're
feel
in
like
the
I
top
could-
3 tips now, okay? Does your neck feel better? Huh? Does your back feel better?
It's starting to.
Yeah.
I went on the sauce cleanse. It's
Yeah.
really helping. I think
The sauce cleanse.
Yeah. I think
Yeah.
I can. Oh yeah.
Ooh. Wow.
Oh my God, I'm starting to get better.
Yeah, look at that.
My arm is
Your
still
arm's
broken,
still
but
stuck. Well,
yeah, we'll see.
you did a lot of masturbating after that yoga class. So, all right, number 3, everybody, top 3. Want better sleep? Watch The Earthing, okay? It's a movie and sleep grounded.
So anyway, years ago, or a couple of years ago, a psychiatrist from the University of California Medical School emailed me, and he said, "Hey man, thanks for publishing your sacroiliac joint protocol." He's like, I was able to fix myself. I've had it for years. And then he said, a quick side note, he said, and I started checking my psychiatric depressed patients that were told that their pain was in their head. And he goes, and they all had it. I'm like, I know, man, they're all in psychiatric clinics. It's crazy. But anyway, while I got you here, I'm like, what's new in the world of, natural ways to help inflammation and pain? So he sent me this documentary, and I was mildly offended by it when I opened it up, because I was just like, what is this? And basically it has to do with the electromagnetic field of the earth. And when you go to the beach and you feel really relaxed, yeah. So, and there's a whole science behind it. There's 21 peer-reviewed studies now out showing marked physiological improvement in inflammation, pains, and then also sleep. And I use it and I relieve people's neck tension with it. I will never not sleep without it. So it's a grounded pillowcase. And if you watch the Earthing movie,
Like this?
if you watch the Earthing movie on YouTube, it went viral. There's a cardiologist in there that says that guy should win the Nobel Prize. I agree. I use it clinically in here to relieve neck tension and inflammation. It works great. And it's super simple. It's like $30 to buy a pillowcase. You got to give it about 2 weeks. And if you don't think it works, unplug it, watch what happens.
Wow. So
Very
it's
cool.
So it's all about like the earth. I mean, sleep is very important.
Oh yeah, it's
Sleep
the
is
ultimate
good.
healer.
Yeah. And
Right?
and so okay. Yeah. What's it called? The earthing?
The earthing. God,
Yeah.
just thinking
We
about
should
that
wa-
makes me just thinking about that makes me want to.
I can fall asleep right now. Yeah, no. When I go to the beach, I feel very relaxed. I can't go in the water though because of my neck injury.
I think my arm is. I think I'm good. No, yeah. Oh,
we
God.
should watch that in the movie theater.
We
later.
should.
Yeah.
We should. Yeah.
So that's okay. Yeah, we should probably buy one of those too. Because
it's a grounding pillow?
I love sleep. And any way that I can improve my sleep, let's do it. Give me all the gizmos and gadgets. Hang me upside down like a bat. Do whatever you need to. I'm down to have the best night's sleep in my life.
Well, gosh, yeah, sleep is so important. Sleep is so important.
Should we move on?
Yeah, you know what? Why don't we tackle these two tips together, since I know we're in a little bit of a time crunch.
Okay.
Yeah? So the top...
It takes time to heal, but sometimes I got nothing.
Okay. But sometimes I got nothing. So the top 2 tip is most headaches are stress-related, including migraines.
Yeah. Well, I know the source of my migraines.
Oh, my God. Oh my God, same.
So I see people in here all the time, and it's extremely rare I can't get someone's headache to go away instantly. And someone taught me this years ago. I didn't develop this, but there's a joint in your neck. It's a vertebrae called C2. It's right here, and there's an artery that runs right up through it called the vertebral artery. It goes up to your brain. And so when you mobilize that artery, when somebody has a headache and you mobilize, the bone and free up the artery that's being kinked, then all of a sudden their pounding headache stops. So usually in a minute, I'll mobilize that joint, and then in a minute I'll ask them, I'll say, how's your headache? And they're like, it's gone. And that including migraines. So most headaches originate from tension headaches and then turn into migraines after that, but it's extremely rare that I can't get a headache to go away within a minute. And then also, I've developed all kinds of other ways using acupuncture points and stuff like that with electricity to relieve pain. I'm gonna publish a paper on it one day, probably.
Wow.
But most headaches are actually stress related. They do Botox. The question is how do you keep them away, right? They do Botox to paralyze the muscle. They give you skeletal muscle relaxants and all kinds of things to dilate your arteries. But it's being kinked right here, so you just realign it. And then the other thing you do is the earthing movie, the grounded pillowcase, relieves neck tension. And then there's a device, actually, I don't have anything to do with the company. It's called the Fisher-Wallace, and it doubles serotonin and beta endorphins. I use that to spike their serotonin, which is a relaxing neurotransmitter, and then their necks relax. So in about 4 to 5 weeks, their necks relax. And that device is, I think it's like $700 or something, but they always have deals on it. And I recommend
Take my money.
Take my money, please.
Take my money, please.
I recommend it different than they do. I recommend it for hour and 20 to an hour and 40 minutes a day, but it's been around for 40 years and it's less than 1% side effects, and it's doubles your serotonin and beta endorphins. So it's pretty cool.
Yeah, it's so cool that you can, instead of taking like a handful of Tylenol or getting surgery or doing all this stuff, all you gotta do is massage this one point,
it really
or
crazy.
just realign your neck a little bit, and you're back to normal.
Yeah.
So it makes it seem like everything else is just a scam. Because there are ways
it's
to
more like treating symptoms, which is our current medical model. You got a pain, here, take this, right? But I'm obsessed with the root cause. If we're not talking about the root cause, I'm not really interested in the conversation. Right. And the reason why is because I'm not interested in treating symptoms. I'm interested in getting to the root cause and fixing the problem. You know what I'm saying?
Yeah.
So that is, the root cause is that C2 vertebrae, and a lot of people. Now, of course, there's other reasons people have headaches, but a lot of women say, "Oh, I have a hormonal headache," and then I do that mobilization and it's gone. And I'm like, no. I think the hormonal imbalance that happens at that time of the month is causing the tension in their neck, and then throwing the C2 out, and now they got a headache, so.
Yeah.
The other day I threw out my C3PO. I'm sorry, it was dangling.
Yes.
I had to. That is really, really mind blowing.
Yeah.
That.
And what do you do? Just massage that point right under the.
No, it's actually, I don't recommend doing it on your own, man. But it's kind of a sensitive spot for your neck. But right about here, right underneath this little bone, there's a joint, there's a vertebrae, and you just have to mobilize it anterior. I recommend going to somebody who knows what they're doing
Well, I guess we're going to Tampa, huh? Yeah.
Very
All right, cool. Well, we're on the number one tip, everybody.
One tip, guys. This is the most important tip about physical therapy and understanding the importance of it.
Yeah. The number one tip is most back pain is mechanical in nature. Okay?
Just you reading
because
that.
We're robots.
Just you reading that, I'm like, I got to sit up straighter.
Right.
I got to freaking.
Yeah.
All right, I just published a paper on this called "Root Cause of Sacral Torsion and Shear," and I also published another paper on sacroiliac joint dysfunction. So, having a clinic where everybody's failed everything and getting 99% amount of pain immediately and 99% of them better, I can tell you definitively that all these people walking in here that have failed everything, physical therapy, chiropractic, injection, surgery, orthopedic surgeon, neurosurgeon, x-ray, MRI, massage, acupuncture, it goes on forever. Most of them have their spines fused and then they can't figure it out. They take out the hardware. And what I found is that if I just realign their hips like I showed you, that this was the cause of their pain. So
there I am.
So they had an upslip on their pelvis and then an out flare, and I pulled back down, I realigned it, I gap it open, and then their sacrums rotated, causing a shearing pain at the base of their spine, or they feel pain along their tailbone, and I realign that and instantly it's gone. And then I if you read my papers that I published on it, I developed protocols to address that work for me 99+% of the time, and they're used all around the world. So it's a contrast to what the medical system thinks. The medical system says, oh, it's disc related. Oh, you herniated a disc, which is, that happens. And that is, a major cause of pain and, down your leg usually. But I find most back pain is actually mechanical, which doesn't show up on an x-ray and MRI, which is why everybody misses it. And which is why I got people in here, over half of them are suicidal.
Right, yeah. Ryan, could you describe further what just for the audience and for us, what exactly do you mean by mechanical? Is it just like the way you go about life?
No, the mechanics of the pelvis are off.
Oh,
yeah.
Oh, I understand.
Having a herniated disc, like the jelly came out of the jelly donut touching a nerve, right?
Oh, okay.
What I'm finding is that their biomechanics are off, causing shearing bone on bone pain. And that's about 80%. I think it's about 80% of back, buttock, and a lot of leg pain, and numbness and weakness too, going on there. And I developed that evaluation method, or multiple evaluation methods that you can read, and and it proves that that's what's causing it. So I got these people like in Europe and stuff that their clinics just explode, that they learn how to diagnose this and treat it. And then all of a sudden they got people flying to them from other countries because they're like a light in darkness, because there was no way to diagnose truly if it was SI joint or nerve issue. They just would take an MRI and say, oh, well, look, you got a herniated disc, must be that, then they'd have surgery and it wouldn't work. And then they refer them to pain management, and then they're getting injected the rest of their life, but I figured out that it was actually, most of it was mechanical,
Wow. It's just amazing. Like, I don't know, just the human body is amazing. And like and it's kind of like we still don't know so much. And I love that, like, you are so interested in it and you understand and you like take the time and you just, you're not following like every other doctor or therapist and how they've been doing it for like the old ways, and you're like, well, no, this is wrong, and let's get to the root here. It's your joint is just off the track a little bit. You don't need surgery, you don't need 16 different medications, you just need to lift your leg up and pull out your knee a little bit and stretch it out, and then you're fine.
I think if there's anything that our viewers or listeners should take from this is like, if you experience these types of pains or whatever, like it doesn't just have to be a symptom momentary type of fix. There are people out there like Ryan who are so smart and understand it and have a solution-oriented mind that it's really kind of mind-blowing that there's all these different things that you get in the room with somebody like you, and you can usually get to the root of it.
Yeah.
I don't believe that pain just happens. I don't buy that. That's nonsense to me. that there's a reason for everything, and the whole universe is a reason for everything, you know? Yeah. And so when somebody comes in and they're like, oh, my doctor said I just have to live with it. I'm like, no, you don't, you know?
Right.
And
how dare they?
They just didn't either know how to evaluate it, or they missed it. You know what I'm saying? So I'm just really curious. I have to know. I suffer from obsessive compulsive disorder most of my life. So I'm obsessive about, I have to know why my patients are in pain. And if I don't know, then I have to figure it out, you know? So that's what I've done in my career. And I've made a lot of discoveries, and, I'm publishing a lot of things. So.
Amazing.
Yeah, and we're gonna put all the links to like your articles and your website and everything on this episode on YouTube everywhere, so everybody can reach you, because this is probably one of our best episodes.
This was fantastic.
This is great.
Super informative.
Yeah.
Guys, thank you so much for watching the Men of Doozy podcast. If you please comment what your favorite part about this, or if you had a epiphany about certain things based off of these tips. And please, share this with your friends.
Yeah, share this with your friends. Subscribe,
especially if they're dealing with this stuff.
Yeah, if you're wearing a neck brace right now, just know that you're probably fine.
Yeah, you just have to get Ryan to say, "I think you're fine."
Yeah, you're fine. You're probably fine. Yeah, share this, and one more time, let's give it up for our guest here.
Thank you, Ryan. Ryan,
thank you so much for coming out with us. Do you have any final last words?
Yeah, parting words. Any type of.
I do have one. I didn't mention it, but I also published. I figured out the root cause of plantar fasciitis, Achilles tendonitis, shin splints, something called anterior tibialis tendonitis, and something called works with Seaver's disease. That it's plantar fasciitis is not. I've really never had anybody that can't get better with plantar fasciitis that I can remember in over a decade. It's actually an ankle issue. There's a capsule that surrounds the joint in your ankle that gets too tight, as well as tightness in the calf. Anyways, I published that. That's on my website too. And people can do that and get rid of their plantar fasciitis as well. It's super easy. It just takes, 5 to 8 weeks usually.
Yeah, I was hungover the other morning, and I definitely had a plantar fasciitis. Okay, I did.
I think this takes the cake so far as the most. We are the most on brand in this episode because I do not feel qualified to be speaking.
Right. Also, don't eat a lot of cake. We're vegetarians
now. Or
go-gurt
or yogurt.
Yeah. Or
this
go-gurt.
was absolutely amazing. Thank you so much. We'll link all of your social media and website in the video and all that stuff. And everyone listening and watching, if there is something that you want to learn about and have us teach you in the future while we also learn about it, or you have guest ideas, please let us know.
Makes sense to me.
Yep. Hey,
love ya. Your arm's better. Whoa,
yeah.
whoa.
Stay safe. Oh God.
Oh wow.
Stay safe out there. Keep. Take care of yourself.
Wow. Is there a neck brace for your voice? Okay, goodbye, everybody.
Bye. Stay safe.
Yeah.